In today's video, I'm going to give you a couple very important reasons why you have the neck and the shoulder pain and that is not connected with your spine. Yeah, my dear viewers, there is a couple of problems that you probably have them, and if you have chronic pain in your neck and your shoulder, maybe this is the reason. Think about it, how many people go to the massage therapy, chiropractic care, or even physical therapy with little or no results? Many of my patients are one of them. In fact, many of people go to the chiropractic college hoping to fix shoulder problems, but it never works. But why? Because they treating the symptoms instead of the real cause. Here is the connection that almost nobody talks about it. It's going to be your gallbladder and the liver can actually trigger the pain in your neck and the shoulder. Let me explain. Your gallbladder is a small sac under your rib cage. Its job is to store and release bile, a fluid made in the liver that helps you digest fast. When everything is worked properly, bile flows easily from the liver to gallbladder and then into your small intestine when you eat. But here is the problem. If your cholesterol is high and your bile salts are too low, bile becomes thick and sluggish. And before gallstones even form, the sticky fluid creates what is called bile sludge, which clogs the duct and increases pressure in the area. So maybe you are one of those people. Maybe you have the liver or gallbladder issues and you have those bile sludge somewhere in your body. But a lot of time people have some kind of compresses nerve in the area around gallbladder and the liver that put the pressure on the special nerve. This pressure irritates something called phrenic nerve, a nerve that runs from your diaphragm up into your neck and the shoulder. That's why so many people feel pain in the right side of the neck, shoulder, or even down in the right arm, even though the real issue is below the rib cage. How you might be wondering, what causes the congestion in the first place? There are several triggers. First is going to be hormonal imbalances, especially estrogen dominance. This is common in women taking the birth control pill or hormone replacement therapy. Or maybe it can be medications such as statins, antibiotics, and antidepressants. We can damage the liver and reduce bile production. Or maybe that be dietary factors, including too much alcohol, sugar, refined carbs, or the junk food. When bile isn't flowing, the result is not just only pain, but also poor digestion, bloating, and sometimes even skin issues. So how to fix it? The first step is going to be remove the triggers, cut down the processed carbs, sugar, alcohol, and the unnecessary medication whenever it's possible. That's why this modern food that we eat is causing a lot of damage in our gallbladder and our liver. Some people, this is maybe information that you never realize. This is especially important for everyone who suffers more than 3 months, 6 months, maybe over the year, and so forth with the shoulder and the neck problems. And you cannot fix the problems because you are addressing something else completely different. That's why you can visit your medical professional and try find some kind of diagnostic procedure that can you see that your bladder or gallbladder or liver function properly or does not. The second step is supporting healthy bile flow. There are a few powerful natural remedies. First one is going to be bile salt, especially TUDCA. Can thin the bile, reducing liver fat and improve digestion. Second is going to be taurine. An amino acid is essential for the bile salt production. Increasing taurine in your diet or through the supplements can restore proper bile function. Or you can add liver-friendly foods like cruciferous vegetables, broccoli, kale, Brussels sprouts. They all help detoxify excess hormones and support bile productions. Or you can take minerals like zinc or magnesium are cofactors that your body needs to make this bile efficiency. Now here's the really interesting part. There is a simple 30-second test you can do to find out if your shoulder or neck pain is related to your gallbladder. Take your hand and press gently underneath your rib cage, moving back and forth until you feel tender spot or not. Hold pressure there for a few seconds And if your neck and shoulder pain starts ease almost instantly, that is strong sign your pain is referred from your gallbladder or liver, not from your spine. And that is also important information. That is also this rib cage. You can put a gently, just a pinch or gently kind of massage, and if you feel some kind of lump over there and if you massage it gently, probably you feel a release of those kind of pain in the shoulder and the arm, and this is probably the reason that you have these kind of problems, and you can address it. I've seen this work in over 80% of the patients in my practice. The relief can be immediate, but the long-term solution comes from the improving your diet and supporting bile flow. This problem is much more common than people realize, and unfortunately, traditional treatments like surgery, painkillers, chiropractic adjustment or massage won't correct the root cause. This is nutritional and the lifestyle issues, not structural one. So next time you go to someone or you know someone who struggles with chronic neck and shoulder pain, that just won't go away. Remember this, the real problem might be your liver and your gallbladder, and that's why I recommend you share this video to the people you know, especially people who have neck and the shoulder problems. Maybe if you if you already have those kind of problems for the months or the years, maybe your liver and gallbladder is the issue. My dear viewers, if you want to find a lot more information about natural remedies that can help you a lot with your neck and your spine, watch my video right here. Thank you for following, my dear viewers. God bless you. God bless your family. See you next time. Bye bye.